Hey, welcome everyone, and thank you for being here with us today for the webinar Defining Gender-Based Violence with 2S LGBTQIA plus communities. Just going to start with a little bit of housekeeping, just to give us all the background information for these online events. And then we'll go into some introductions and get started with the presentation. So this is a topic about gender-based violence, which sometimes is a challenging or hard topic for folks. So we're just asking that everyone please help maintain a respectful and inclusive trauma-informed space. We've also dropped a few suggestions for grounding the space and housekeeping in the chat here. Um, Please engage with care and respect for the experiences everyone is bringing into this space, and check in with yourself and do what you need to take care of yourself during this hour we have together. We have a Q&A feature that you can submit your questions as we're presenting, and we're going to have some time at the end where we'll be able to go through as many questions as we can get to near the end of the presentation. But please feel free to drop questions in as we go. Please avoid sharing personal and identifying information in the chat or the Q&A feature. This is a reminder that this is a public event. There's folks from many different places joining today, so just be mindful of how you engage and what kinds of questions and information you share. For technical assistance, you can message the CBRC tech support and webinar support in the chat with the name CBRC info. Thanks for starting with those kinds of details. And I'll just start with a bit of an introduction for myself. So my name is Maddie Walker. My pronouns are they, them. I'm a postdoctoral researcher at the University of Northern British Columbia in the School of Health Sciences. I'm calling in today from Lekwungen territories on the lands of the Songhees and Esquimalt nations. Over the last year, I've had the honor of working with CBRC and a team of community collaborators on this project, where we've been exploring how 2S LGBTQIA plus communities define and understand gender-based violence through arts-based approaches. Today, I'm joined by two of our team members, Jaylene McRae and Katie O'Brien, and we're going to be sharing some of our initial findings from the work, as well as our process of research with our queer and trans communities in the Fraser Health region. So to start, I'd like to invite Jaylene and Katie to introduce themselves. Maybe Jaylene, you can go first.
Sure. Yeah, we were going to fight for the mic, right, Katie? Well, good morning. So my name is Jaylene. I am with the Two Spirit program. I'm a Two Spirit community engagement lead, and I'm broadcasting from the unceded territory of the Musqueam, Tsleil-Waututh, and Squamish First Nation, otherwise known as Vancouver. I also just want to mention that my ancestral ties are in Treaty 4. I'm registered with Zagame and Anishinaabe with maternal roots in Kawakatus First Nation and Métis Nation, Saskatchewan.
Thanks, Jaylene. My name is Katie. I use they, them pronouns, and I am a research coordinator at the Community-Based Research Center. I am joining from what is known by the Mi'kmaq as Dagamguk. Uh, that's incorrect. That's where I'm originally from. Sorry, everyone. I've got a bit of a cold, so my brain is a little bit out of whack. I'm joining from Jabukduk, which is the Mi'kmaq name for the area currently occupied by the city of Halifax, in Mi'kmaq.
Thanks, Katie. Thanks, Jaylene. We can move to the next slide now. Thank you. So today our presentation is based on the Reach into Self-Expression project, also known as RISE. This is a participatory arts-based project where we're understanding experiences and needs of 2S LGBTQIA plus communities and gender-based violence survivors. This work is a collaboration between CBRC researchers at the University of Victoria and University of Northern BC, the Health Initiative for Men, and art therapist Jillian Bagan. Our work was guided by the input and collaboration of 7 community advisors, and our work was funded by Women and Gender Equality Canada. What we share today is based on 2 years of work our team engaged in the Fraser Health region of BC. We connected with 7 service providers through interviews and 21 community participants through 11 arts-based sessions and interviews through August 2025 to January 2026. And in March 2026, we held a community art exhibit where we showcased participant art and shared our initial findings back to the community. Gender-based violence, or GBV, is a broad umbrella term that refers to violence, abuse, or harm directed at someone because of their gender or gender identity. It includes physical, sexual, emotional, psychological, and systemic forms of violence. And importantly, gender-based violence is not only about individual acts of violence, it's also shaped by broader systems of power and inequality, including cisheteropatriarchy, colonialism, racism, and ableism. Defining gender-based violence is complex, and part of our work over the last year has been exploring how our queer and trans communities understand, define, and experience gender-based violence. One of the challenges in discussing gender-based violence within queer and trans community is that many existing definitions, policies, and services were developed with cisgender and heterosexual experiences in mind. As a result, some experiences of violence affecting queer and trans and two-spirit people have been overlooked or misunderstood. And this is part of why our community-led research has been really important as we're seeking to understand how our communities actually define and experience gender-based violence, rather than assuming current existing frameworks capture the full picture. So today we're going to share about our process and our work on understanding this and talk a bit about some of our initial findings. So I will pass it over to Katie and the next slide. Thank you.
Thanks so much, Maddie, for kind of setting the stage. I'm going to briefly go over some of our environmental scan findings before we move into the arts-based findings of our project. So for our environmental scan, we reached out to a number of service providers in the Fraser Health region who provide gender-based violence services to folks. We reached out to some GBV specific services, but also to a lot of nonprofits that offer GBV services within a broader scope of support to community members. Our team reached out to around 25 services and heard back from 7. So we know people are busy. It's hard to connect with service providers in this way. And we also have a bit of a suspicion that folks may have self-selected out of our study based on the specific to us LGBTQIA plus perspectives that we were looking for. Because we know that there are services that do not provide supports to queer and trans folks, and yet all 7 of the services that we talked to were really supportive of queer and trans community members. In terms of the findings from those interviews with service providers, we came up with 5 overarching themes that came through. One of the themes was an unhelpful siloing of work. So talking about the funding landscape of how people access care. It's really difficult to kind of understand how people are talking about GBV when they label their services in that way. And so sometimes it doesn't really make sense to have a GBV specific program and a non-GBV specific program doing the exact same work, but having no connection to one another. Another theme that we found was that there is a lack of data about 2S LGBTQIA plus service users, and in some cases that's intentional. So a lot of the service providers that we talked to discussed having very low barrier intake forms, some not having intake forms at all, or having very few pieces of data that they take in, so that it's easier for folks to access the care that they need. But because of that, we don't have data about the numbers of queer and trans folks that access those services, for example. And folks were also really clear about, if they were going to change that practice, needing to know how that information would be used. So not just wanting to collect information for the sake of having that information. we noticed that there were lots of folks talking about a changing service landscape. So many folks, as Maddie mentioned, were working in organizations that either started as only providing services to cis straight women, or started by providing services to cisgender gay men. And all of the services that we talked to were kind of in a flux period of expanding their mandates. CBRC went through this a couple 5 years ago as well, right? Expanding our mandate from just focusing on gay men's health to exploring to us LGBTQIA plus health more broadly. And that's changing service landscape while opening up a lot of experience opportunities for queer and trans folks to access care that they may not have had access to otherwise. Also makes things confusing, right? To figure out, am I allowed to go there now, or are they still, not really aware of what I need as someone who's coming to this service for the first time? Service providers also described a flexible understanding of their work under the GBV umbrella. So, like I said, some folks didn't really think of themselves as gender-based violence workers, but they were providing care to folks who had experienced gender-based violence. Or some few folks had not really thought about the term gender-based violence or GBV at all. And through our conversations with them, came to understand their work as being part of an umbrella term. We also had some conversations with folks who did describe themselves as gender-based violence workers, who talked about how it was important that that language was flexible so that they could get folks support that they needed and not kind of shut that down by having a really rigid definition of what their services were or what experiences people had to have had of violence before accessing service. And then the last piece that I wanted to share around the environmental scan today was that everyone talked about how scary the political and funding landscape is at this point, both uh, because of the gender-based violence aspect of things getting like less funding than ever, the queer and trans aspect of things getting less funding than ever, the physical location of Fraser Valley feeling like an increasingly right wing, like kind of a scary place. And so folks were really worried about continuing to have the meager funding supports and political supports that they already have into the future. So worried about the upcoming possibilities for their programs. All of these findings are expounded upon in community reports that will be coming out in the near future. So if you have any questions about kind of more detailed analyses of who we talked to or exactly what we mean by these themes, keep an eye out for those reports. I will pass it over. I believe Jaylene is going to talk about setting the stage for the arts-based sessions and the arts-based work that we've been doing.
Yes, setting the stage, as it were. I also just want to mention, I want to thank Katie as well. I got to be part of those discussions, and it's really well, quite jarring actually when you think about the actual gaps that are out there for our communities to reach out for support. And so it's really important for us in everything that we do, specifically speaking, even in this call and all the other ones where we connect with community across the country, is we have that opportunity and responsibility to create those environments that foster a place that is brave, where people can ask questions and be able to explore further how specific acronyms that we hear. What does it mean to me? What does gender-based violence mean? And I think one of the things and one of the great honors that we had was to be able to define that and actually just realize that a lot of experiences of the people that we were able to meet, and I'll speak for myself as well, it's you just kind of learn that's just the way it is and you just get on with it. and don't even realize that life could be different. You just accept it for what it is. And I think even generally speaking, as a queer person too, as LGBTQIA plus identifying person, we give up a lot just to kind of find our truth. A lot of our rights and our freedoms, we put on the sideline because we want to focus on making sure we go to that path of who we are and who we can be. And so we get lost in the shuffle of all that. If you look at this picture here, and it actually just warms my heart when I see it, because we had a discussion talking about access and talking about how it is kind of like a tree. It's a bunch of different branches. And, at the end of the day, all those roots keep the tree alive and thrive. And it also helps the trees in the area thrive. And so this particular tree we presented this in for our CBRC summit, and we brought that tree and pasted it to the wall, and some literally glued stuff to the wall. But we brought and we gathered, and we created a space where people could explore, create, um, just be able to be with each other. And, I think that there is such power in our unity that when we just do these little projects that allow us to open our mind and our heart, and we're able to share it in a way that is something we're leading. And then you bring that all together. And for myself, as in our Two Spirit program, I find a lot of our power and a lot of our work is through storytelling. That's how we reach community. And I think that this gave that opportunity to really expand on what that looks like. If we could move to the next slide. And yeah, that tree was kind of brought together, sort of a synopsis, a recap of some of the things that we had experienced through the workshops that we hosted. And the thing about coming together, and for myself, is um, I've always been that kind of gal that is like, I like to kind of have options of how I receive information. It's not that I like, it's that I need to have options of how I receive information. That's how I personally learn. And so I was just thrilled to be able to collaborate with some other human beings who just lead in a real gentle, kind way. And with the focus of making sure that we realize we have that opportunity, that responsibility to be able to explore and do the research and find out what people are experiencing and what are some of the things that they need. And for what I've noticed with this is when we connected with people in the indigenous community, with some elders, and we connected with people in our communities, and we brought everyone together. And when you show up, it is amazing on what can happen in that space. Provide some art supplies and some, good snacks, and some fun music and some laughter, and you sit at that table together, and you experience some walls falling down, because through the art and through the topics that we provided, for example, this was the stories of resistance. So what does that mean to you? Let's do it in and express that through art. And you'll see there's a lot of energy there. If we just look at some things there's flowers, there's the heart, there's the hand, there's the strength, there's challenge, there's also focusing about things that make us feel really good and connected. And I think that was the biggest thing that I took away from all of that was I just think it's such an honor when people trust a space. When our intent is to sit with each other and to be able to explore some of the things that a life journey offers us, as queer people, that has been really challenging. We don't always have an opportunity to talk about it, nor do we know if we have the capacity to do that, nor do we trust the people around us to be able to do that. So this is really just scratching the surface of really what's possible. And yeah, so that was something that was very powerful. If we could go to the next slide. So these are some of the topics. Like one of the questions we asked about inside and outside experiences. And, very thought-provoking, very time to pause and to think about how does what we experience in the world impact us, how we view ourselves and how we view our place as we navigate our journey of self-discovery. What does the feeling of being excluded, what does the feeling of feeling fear, what does the feeling of being not able to truly share with pride who you are, how does that affect us, our person, as we move forward and walk this earth? In the outside experiences of what we're experiencing in the world, in our healthcare environments, in just walking down the street sometimes. How does that impact us with how the world treats us and how they view the spectrum of identity and sexuality in the world? And how does it also feel to you when you need to reach out for that support and understand, excuse me, and understand that just like everybody else, we have the right to be able to hopefully live a life that is led by bliss and led with an openness of opportunity and potential that we choose, like anybody else. I think that this really represented to me how resilient and how focused we are to show up in the world and not letting people take away our magic. I think that you'll look at there's a lot, like there's a brick wall. I don't like to identify with painting like a brick, but I'm kidding. A little drag joke there. But I think it's like you paint what a strong exterior, and you see that as like, what do people see from you on the outside? They'll see something beautiful, something strong, something colorful, something unique. What is on the inside? What is the place that you're with when no one else is around? Does it feel very like does it feel very like is it like for some of these, when I look at the back of the faces here, I can feel rage, I can feel fear, I can feel like there's a lot of things that um I don't even know how to share or where to start. And so by thinking about that opportunity to sit there with some masks, and you think it's just a simple activity, but watching a shift happen in people and having the discussions that connect us. We didn't know each other before we came together, but it connected us in a real special way. I think we'll just wait for that other screen to come back up. I think it's coming. Here we go. I knew it was coming back, so we'll go to the next one. This question, preferred futures. Oh my goodness. I think it's just so cool because when we started about having this connected to an option of how to heal, um, like thinking about art-based therapy, to me as a young person, that was the only place that I personally had to escape to, if you will, was my art, my creativity. I didn't understand the world around me. So I would go into my room and I would draw pictures and I would look at fashion magazines and I recreate looks on myself. All that stuff was a creative outlet that focused on creating some balance for myself in a world I didn't understand. And so coming together and realizing, I think a real important contribution that we have for people in general is to let people know when we're shifting environments to be more inclusive and expansive towards the identities in the world. We also have to be really mindful of a healing journey for that I believe includes all of us, but we don't all heal the same. We all have different experiences that we've had, and we have different ways that we navigate and feel comfortable with in order to kind of access some of the maybe the personal work we need to do. And so to have a group of people say, we get that. And what we want to do, and Maddie was saying earlier that We're expanding who we're including in the work that we're doing. And that includes being able to listen to people on what they're experiencing. And even, I can speak from our Two Spirit program perspective. When we were doing the Our Bodies, Our Health survey and traveling across the nation and spending time with people, we paid attention to how people responded to the initial survey and also having conversation to say, let's figure out a way that works for you to be able to understand what our intent is, really to strengthen and make access towards support for you stronger. And if you didn't understand that at first, sometimes it takes a little bit more for us to be able to make sure that that is being, understood and that people feel included in the work. And I personally have had that experience as well. So coming together with a bunch of people talking about preferred futures, well, how do we want to see the world? What do you think is possible? And if you look at some of these images, when you go somewhere and you're sharing something about you're not even sure if you're a victim of gender-based violence, but it just doesn't feel good, and that in certain environments you don't feel comfortable in, and so you reach out and you ask the questions and say, "This is what I feel, and this is what I experienced." We want people to believe us, to trust that what we're saying is something that is important, and we're going to spend time together to explore what that means. So by I believe you, and just looking at also, for example, there's life coming up in a desert. There's connection of community in some of the places where you just think that would be void of. There's all these different ways we can look at these pictures and we can take something for ourselves. We look a little bit deeper. You just take a look and you hear the messaging from people. We do not have to feel like we are not in control of possibility. And if we could dream about a whole world, I say this a lot. If we could dream of a world where the only limit of what we could achieve in the world is our imagination, and when we have an issue that doesn't feel good to us and we're able to kind of connect with other people and get the support that we need quickly and don't feel like we're actually overwhelming somebody or they don't have time for us. I mean, that's something to really work towards. And so there's all these things that are possible. And, I think a real takeaway of experiencing for me was to be able to see, like I said, the partnerships of community resources, which was such a great example of what we need to do. We need to reach out more to different organizations who are doing similar work and come together and maybe ease the workload, because a lot of people do have a lot of things that they're having to keep up to. And so the way I feel that's really important is we start that. I say, and I heard somebody share this about, we create a brave space. We don't say a safe space because we can't guarantee that. But I feel we can guarantee saying our intention is to create a space that is brave. And we're going to start there and be gentle with that. And we're going to allow the discussions to unfold in a way that follows that energy. And my colleague says that part in the chat. And and I think that is a really great place to start. So for maybe we have another slide there. Yeah, and this goes into a really great segue to one of the people that I get to just really celebrate how I really enjoy being part of the Community-Based Research Center is the fact that I get to meet some awesome people. And I get to witness their lives and how they show up authentically, truthfully, and with such grace, with humor. And they also buy merch from me, so that's helpful. But I'm going to pass it over to Katie to share some more.
I love my Jaylene time merch. It's my favorite thing to wear. Thanks so much, Jaylene, for sharing kind of how it felt to be in the arts-based workshop spaces. Um, I'm seeing in the chat, Kristen asked, were the sessions in person or online? And as my colleague Ben says, there were a mix of in-person and online art sessions so that we could try to reach different folks. But after we had those art sessions, we also extended the option for participants to participate in um, an interview about their experiences in the sessions and to kind of give more words to some of the questions that we were asking in the sessions. And this big map with lots of tiny words on it, I apologize for the tiny words on your screen, was one of our ways of trying to understand what folks were telling us about how complex the term gender-based violence is. So, as you can see, there are 5 different kind of color-coded sections that are coming off of GBV, and these are what community members were telling us about um, how they understood this term. So, the first thing that I just want to mention is they came up with a lot of beautiful community definitions, which Maddie has talked to earlier on in this presentation. Jaylene mentioned also um, of gender-based violence being a form of violence or harm or aggression or discrimination or injustice that takes many forms. Um, Community members also linked this violence with it being a tool to uphold violent systems such as colonialism, white supremacy, anti-queerness, anti-transness, patriarchy, and misogyny. Um, and they also were pretty specific in that in identifying GBV as an umbrella term, so that it encompasses a lot of different things. It's not just one thing. Um, the participants that we talked to distinguished these community definitions from what they perceived service provider understandings of this term to be. So participants shared that providers often make assumptions based on understanding GBV as something that only happens by a man to a woman, so a man harming a woman, and usually a cis man harming a cis woman. There's an understanding in the community that providers are not part of the 2S LGBTQIA community or don't have experiences of gender-based violence, don't have that lived experience. And so you can see in this map that the community definitions and the perceptions of service provider understandings creates a rift in how people feel safe or comfortable showing up in services, or even whether people are going to show up to services for support at all. Participants also described the impacts of gender-based violence. So described having different experiences of gender-based violence depending on how out they were or how visible they were in either their trans identity or their queer identity. Talking about gender presentation and visibility and outness. And then we also heard from lots of people about physical and chronic pain, mental load, lots of shame and guilt and self-blame, and kind of internalization of violence. And we also heard that the impacts compound with multiple marginalized identities, right? So we know that folks who experience multiple overlapping identities have specific experiences of gender-based violence that are important to understand and talk about. We had folks share lots of different forms of gender-based violence, which we've talked to. Yeah, Fallon in the chat is talking about intersectionality. Absolutely. Folks talked about lots of different forms of violence that Maddie kind of listed earlier, but lots of different pieces that were specific to 2S LGBTQIA experiences. So assuming STBBI status, for example, or understanding quote unquote conversion therapy as a form of gender-based violence, misgendering, outing, blackmail, corrective assault, and denial of care as being specifically queer and trans experiences of gender-based violence. And then also a whole host of other forms of gender-based violence that maybe doesn't have anything to do with somebody's queerness or transness, and instead is a result of systemic misogyny, etc. The last piece that I want to talk about, which is the smallest piece on this chart, but is something that we're really interested in, is that folks had a wide variety of feelings about the term gender-based violence. So Some folks shared that the term really describes their experiences and gave them words to describe what happened to them that they didn't have before, so that they feel grateful for that term or they feel like it's important. Um, Other folks are like, this is a really vague, unclear term that kind of obscures my nuanced experiences, right? So maybe they would choose a more specific term to describe what happened to them rather than describing themselves as somebody who had experienced gender-based violence or who had been harmed by gender-based violence. They've described also that it's more expansive than other terms, like violence against women, for example, which is another term that gets floated around in this space quite a lot. Um, and then there were different feelings about whether this term was actually used in community at all, or whether it was mostly kind of a professional, clinical, or research term. So we will continue doing more analysis on these interviews. We will be expounding upon this in future work. And if you are interested in being able to actually read the words, because they are very small on the slide, like I said, this will be available in the coming weeks and months. And I'm seeing Kristen's question, did spiritual / religious based violence come up at all? And yes, that was one of the forms that kind of showed up in folks' descriptions of gender-based violence that they had experienced. It wasn't, I would say, the most frequent form, but it was definitely present in our interviews. And I will pass things along to Maddie.
Thanks, Katie. We can move to the next slide, please. So as Katie was speaking to the information that we were processing and analyzing from the interviews with the participants that had participated in an art space session, at least one, several participants participated in more than one art space session. And Jaylene was sharing about the process of creating spaces for creating that art and coming together and having conversation and art making. So we wanted to continue that approach through our analysis of the artwork itself. And so we came together as a team and did a collaborative data analysis with the art pieces. Our research team and some of our community advisors met either in person or online, and we viewed the art that participants had made and had discussion together, and then also made our own reflective art making to process and think about what were we seeing and what were we noticing in all these pieces that the participants had shared with us. One of the key takeaways that we noticed is that this resistance that we were seeing through across so many of the pieces was represented not just in like confrontation and conflict, but through persistence and like self-definition and continued existence and connection to community. That there's a lot of strength and healing that happens when we can come together and witness each other's stories and hear each other's perspectives and maybe see our own experiences and somebody else's experience as well. The artwork really highlighted the complexity of lived experience that our community brings into these conversations. We saw layers of images and texts and materials that reflected the ways that trauma, healing, identity, culture, and community all intersect and influence each other to create possibilities for healing and each individual's unique experience. One of the things that we kept noticing throughout this entire process is the importance that art played as a space for expression for experiences that may be difficult to articulate verbally. So in this project, we're holding spaces for having these conversations and making things like that mind map that Katie just showed us, where we're trying to understand what words are people using, but then also holding space for what are the images, how are people expressing this, and what are we seeing, and what does that tell us that words can't always communicate as strongly. So this way we're really seeing art as a medium of the storytelling and the truth telling in this project. We can move to the next slide. Let me just find my place on my notes here. So what we're really noticing as we're starting to think about these initial findings, and as Katie mentioned, we're continuing to work with these and continuing to develop resources and things we can share back. is this study points to a broader issue in how gender-based violence is understood and recognized and addressed within 2S LGBTQIA plus communities. Many participants experienced forms of violence that did not fit in dominant understandings of gender-based violence. So as a result, many participants felt that they didn't initially recognize their experience under this term of gender-based violence, which created barriers to accessing support and finding things that could be helpful to them. This suggests that current definitions of gender-based violence really don't accurately capture the realities of queer and trans communities. This also helps us see that recognition is closely tied to access. So when survivors do not have the language to identify their experiences as gender-based violence, but this is the language we're using to talk about services and what's available, it's really difficult to determine what support is needed and where to find it, and where to find others that may have similar experiences where you can find community and connection. So while we're noticing these barriers here, we also are holding that space that participants in this project really emphasize the importance of community. So healing was described not only as an individual process, but something that was supported through relationships and peer networks, cultural spaces, community organizations. So when we're thinking about, well, what do we do with these kinds of findings? What's the next step? It suggests that effective responses to gender-based violence must extend beyond just formal services and recognize the critical role of community-led supports that can offer spaces for survivor well-being and connection alongside and in support of other professional and more formal services and supports that are needed. The findings point to a need for more inclusive understandings of gender-based violence and a stronger investment in community-led initiatives that can support sustainable responses and address these like competitions that we feel between our different organizations of trying to create different services and competing for, like, you know, Katie mentioned that the limited funding and the scary funding landscape that we find ourselves in. So we were thinking about, well, what can maybe people that are here in this webinar do today, or what can services do to start addressing these changes that we're noticing are needed? And a very a clear and hopefully feels actionable way to do this is working towards clearer, more inclusive definitions of gender-based violence and explicitly talking about what services are you offering and who can come, who can be there in your services, and who are you welcoming into your space. Clearly articulating scopes of support and services and who you're working with can really help people find the support that they need and see themselves being able to access that support. Like, oh, I can go here. Maybe I actually do need this and I deserve this kind of help. Further, services and funding agencies can prioritize strengthening community-based approaches that are already happening. As we know, there's often a lot of community leadership happening that happens in unfunded spaces or minimally funded spaces. So when we can notice what's actually happening already and strengthen that and collaborate together, we can create collaborations instead of competing for these limited resources that we find ourselves in. I'm just looking at, lost my place there. Okay, we're good for the next slide. Thank you. So I'm aware of the time. We want to leave time for questions and discussion, but we do want to let you know about what else we're continuing on with. So this project happened over the last year or two, and we're looking to continue to expand this work. We're going to be doing similar community engagement through arts-based workshops in Northern BC and the Yukon, and we're also expanding this work through creating regional community co-researcher groups where we're going to be imagining different community responses and seeing what kind of creative responses we can make together through arts-based and land-based approaches. we'd like to keep in touch. So if you're interested in keeping in touch with us, we have our emails up there. We're open to questions and connection. And we also, as Katie mentioned, we are creating some more shareable resources, and as we continue to process our all the information that participants shared with us, we're making some community reports and practitioner resources. So please visit the project webpage that is on the CVRC website. There's a QR code there for easy access. But before we move into questions, I just want to see, like, Katie and Jaylene, did you have any other last words you wanted to share?
I could. Thank you so much. There's just so much information here, and I think it's so interesting to see how fast time goes by, and then you see at the end of it what was achieved. And, we had the art show, which was so spectacular. But also into the question, there was something about a question about spiritual religious based violence and that topic. And I think one of the things I thought was really valuable is that we hosted different spaces to be inclusive to different demographics of people. And I think that there was one space specifically where we talked a lot of focus about indigenous ceremony and how that can be really a connecting factor for people to kind of feel comfortable to start a healing journey. And there's a sentence that somebody says, you just kind of feel you're in the right place when they say, I haven't said this to anybody. I've been holding on to this for my whole life. And if you create a space where somebody feels like they can say something, you know that that's really valuable. And so there definitely was the talk. And this is just, like I said, this is just introductory towards what's possible. And so we look forward to moving forward and expanding sort of what that looks like, and having more rich discussions. But I think that this was really excellent to be part of.
Yeah, thanks, Jaylene, and thanks, Maddie. I could talk about this project forever, but the last kind of just piece that I would love to share before we get to your folks' questions, is just that this project has really reminded me how important the team that you're working with is. So from the initial team who worked on putting together the grant, my dear friend Anuradha Verma supported doing that work, working with Maddie and Jaylene and Jillian and the folks at HIM was like, it would not have been the same project without these specific people. Um, our community advisors are brilliant and phenomenal and creative and connected to community. And again, it would not have been the same project without those folks. And as we move forward for the next year to 3 years, we've got a couple of different parts of this work that will be moving forward. We get to connect with more folks. We've onboarded a new community advisor who is up in the Yukon and connecting with Sky, who's up in northern BC, joining our team. I just am really excited to see how changing folks on the team and incorporating more folks into our community will shift the work going forward.
Thanks, Katie. And yeah, thank you for that acknowledgement of all of the different people that were part of this work. And I think, like, through all of this last year, and then thinking forward to the next things that we're going to be doing, it's about those relationships, right? And creating spaces where that connection can happen. And I think that happens at multiple levels in work like this, right? It's in the team, it's in the spaces we invite people to share their stories into, and it's also in places like this, like a webinar where we're inviting folks to, listen to us for an hour, and then also think together with us and ask questions and bring your own thoughts and ideas forward. And that's how this work happens, right? So I do open some space for some questions here. I know a few folks were asking things in the chat that got answered a little bit earlier, but I'll expand on one of them while other folks are thinking about some questions here. One person asked, were the 11 sessions in person or online? So how we formatted this is we offered 4 cycles of sessions. 3 of these cycles were in person, and we held these in Surrey at a community space there that we invited people into. And 1 cycle was online, to be able to invite folks that weren't able to come to the in-person ones, and have just a wider range of folks that were engaged. I'm realizing as I'm speaking, 2 cycles were online. Actually, we had 2 different groups of folks that joined online, and were able to join in that way. And so we did art making together, and each session was co-facilitated with art therapist Jillian Bagan and Jaylene, and I was there for support as well. And we also had Elder Dixie Lee Vance there supporting as well. So thank you for that question. I'm noticing another question in the Q&A. Katie or Jaylene, do you want to take that one?
Yeah,
Oh,
so
wait,
the question, I can answer some of it, and then Maddie, I might need to tag team. So the question is, can we clarify how many people participated in each part of the project? So, oops, there we go. Answered. Here we go. Um, as I said, for the environmental scan, Jaylene and I talked to 7 different service providers. So that was for the like the slide with the 5 things on it. I don't know if that's a helpful frame. And then, like Maddie said, we had 11 discrete webinars with different numbers of folks participating in those webinars. So, Maddie, I don't know if you have those numbers off the top of your head.
Sorry, 11 workshops. And so we had 21 participants join for the arts-based workshops. Right off I don't have the exact stats right in front of me in terms of how many people were in person and how many were online. But it was about equal numbers, but I won't say exact. And then from the arts-based sessions, everyone that participated in those sessions was invited to do an interview, and 18 folks from that group opted to complete an interview. So we had opportunities to talk more in depth with those 18 people that had participated in at least one of the arts-based sessions. And then we did an online interview with those 18 folks. Thanks for that question.
There's a question that came in that I want to thank TJ for providing there. You know, we did have a trans-specific discussion, so we had a place to where our trans relatives could feel, you know, welcome to you know, say what they needed to say. We didn't have that specific question brought up, but I think this just poses like the importance and the impact to create spaces that allow people to be able to ask a question maybe they didn't feel was welcome previously. So I look forward if you want to connect further to me afterwards, and can keep you in the know about what we have coming up next. But I just wanted to say that I see you, and I really value that message.
Yeah, I agree, Jaylene. And I think the other piece that I'm thinking around TJ's question around um, pre-transition gender-based violence, quote unquote, as a trans masc human that now gets read as a cis guy. I think this is one of the reasons why some of this language around violence against women, or more kind of traditionally gendered language, makes it so difficult for so many queer and trans folks to access support. And like I'm thinking about quote unquote women only spaces, or even some quote unquote men only spaces, make it so difficult to share the nuances of the violence that we've experienced and the harm that we've experienced in a way that's like actually going to get us support. Um, which is why I think expanding the definition of gender-based violence and being clear that we're not talking about um, this kind of stereotypical cis man attacks cis woman experience, and it's more complex and more insidious than that, will help us get more support to everybody. I have so many other thoughts, but I will contain them here. I'm seeing another question in the Q&A box, which asks about effective ways to reach people who actually shape HR policies in workplaces, especially policies that could help prevent or eliminate gender-based violence. Um, Also, how could this research or our findings realistically make their way into decision-making spaces? And I wonder, Maddie or Jaylene, if you have thoughts about this.
I can start there. I think like that question really makes me think about how we share what we find in projects like this in multiple ways. Sometimes information that comes out of a project like this sits in one sort of report that is quite dense. It's long, it's hard to read and bring into your work when you're a busy person managing an HR department or writing policy. And so we're thinking about ways that we can translate these findings into like easily accessible, actionable suggestions and recommendations. So we're still working on that right now. I think it's just such a good question and reminder to be thinking about like how do findings like this actually go to places that they can shift and make change. So I think I just want to say thanks for that question, and we're definitely thinking about it. We don't necessarily have a direct answer right now, but we're working towards it. Jaylene, did you want to add anything to that?
Yeah, I did. I think it's about consistency and making sure that we don't stop this conversation by, inquiring what people have available. And also I think it's, I sometimes speak from the perspective of our Two Spirit program, making the language accessible, which is amazing. So more people can be able to ask the questions of what they need and don't feel like they're excluded from it. And I know that it's also with funding structures too, holding people accountable towards thinking about who's left out. Like, and I always think that that is something that's important to move forward with. But to the answer to the question simply now, because we could talk about this all day, really, it's just to continue to have these discussions and think about who's left out and make sure that that information is accessible to more people than ever have been before.
Thanks, Jaylene. I think that's the perfect place to leave things for today. I just want to say thank you to everybody for being here today, and thank you for your questions and your comments throughout the presentation. Really appreciate you being here. And like I mentioned, we are continuing to build different resources for sharing this knowledge out. So please check back on the CBRC website for more stuff coming your way. Thank you, everyone.